Dental floss. These could come looking like flat tape or thread, like embroidery woven, waxed or unwaxed. The type of dental floss that you use depends on the space in between your teeth. Floss was created to get into the spaces between your gums and teeth where your toothbrush bristles cannot reach. There is a part of our gum that is not attached to the tooth, and this creates a space where plaque can go into. How to use dental floss? Break off 10 to 12 inches, almost the size of a ruler. Of course, if your hands and fingers are bigger or smaller than mine, you cut off as much more or less that you need. Wrap the ends around your middle fingers. This allows you to use a clean piece of floss as you go. Pinch or hold the floss tightly between your thumbs and index fingers. Leave only about an inch of floss between your hands to work with. Things to know about your mouth before we start. Your mouth and teeth are mostly arranged in an arch. Your hand position as you get into the spaces will look like this as you move along the arch. Notice one hand remains on the inside of your mouth while the other one stays on the outside. To guide floss between the teeth, first know that the teeth are wide at the top and they get narrow towards the gums. They also oval in shape, like ice cream cones next to each other, not chiclets. Where the teeth are the widest, it could become tight. So when you get the floss in between the teeth, don't snap it down because it could cut you. Seesaw it through. When the floss gets loose, wrap the floss around one side of the tooth. Curving or wrapping the floss around the tooth will ensure that we remove plaque around the corners of the tooth where the toothbrush bristles miss. It will also give us access to that space between the gums and the teeth as we keep the floss firmly against the tooth, moving it along the walls or along the length of the tooth, up and down. Do this around 3 to 4 times on one side, then curve the floss against the next tooth and do the same. As you move from one tooth to the next, you can unroll the floss and get a fresh piece to go into the next phase. Make sure you reach the teeth to the back by extending your index finger. If you find flossing with the string or thread challenging, think about or consider trying a different device like an interdental brush, floss picks, or even a water flosser. 2 of these can be found in your Smyle Therapy dental hygiene kit, just in case you want to sample them.